can make you happy, suppress your appetite, reduce fatigue, increase your attention span, and is used to treat narcolepsy, depression, and ADHD. What magical substance does all this? Adderall.
What is Adderall? Adderall is a stimulant drug and prescription medicine with a combination of amphetamine and dextroamphetamine. Adderall is from the medication group called stimulants. These stimulants are commonly used to treat attention deficit hyperactivity disorder, ADHD, and narcolepsy. This medicine is considered the first line of defense in ADHD therapy. From several studies, Adderall use showed improvement in enhanced attention and focus and reduced impulsive behaviors. Adderall is legal and is considered dangerous due to the high risk of dependency and abuse. What are the uses of Adderall? Adderall is the combination of amphetamine and dextroamphetamine used to treat ADHD. Adderall changes certain natural chemicals from the brain and comes under the class of CNS stimulants. Amphetamine-dextroamphetamine combination helps increase the ability to pay attention, focus on activity, and control behavioral problems. This medicine also helps to perform specific brain tasks and improve listening skills.
How long does Adderall stay in your system? Adderall has a half-life of 9 to 14 hours, which means that 9 to 14 hours after dosage, only half of the drug remains in your body. Adderall will completely clear of your system in 3 days.
When you give Adderall to somebody who doesn't require it and they do not have ADD, in those patients you will see almost like a cocaine-like effect. When you take Adderall, the dopamine is released. Eventually, this dopamine starts to run out. And when the dopamine starts to run out, there's a constant need to replenish it. For somebody who is using it in a regular form, they can continue to function quite well without any adverse effects on the brain. However, someone who starts to abuse medication more than necessary, in those particular people, you will see long-term effects, which is almost a burnout, where you may start to see irritability, depression, dysphoria, despondency, agitation. And those are just the so-called central nervous system effects. And then there is a whole section of the overall impact on the body. It can have numerous cardiovascular implications. So it can increase your blood pressure. It can increase your pulse. It can, when people start to abuse it or using higher dosages, it can cause cardiac arrhythmias in people. It can cause stroke. It can cause heart attacks. It can cause stomach problems, nausea. Those are the most common ones that people experience.
10 facts about Adderall to make you more aware. Fact 1. Adderall is a medication under the class of drugs known as stimulants. Fact 2. Adderall is most often prescribed for individuals with ADHD. ADHD, or Attention Deficit Hyperactivity Disorder, is a medical condition that is often characterized by symptoms such as distractibility, hyperactivity, and inattention. Adderall is known to help alleviate these symptoms. Fact 3. Adderall stimulates chemicals in the brain such as dopamine and norepinephrine. Individuals with ADHD often have a deficiency of dopamine and norepinephrine chemicals within their brain. To combat this, Adderall increases the release of these molecules in the brain and prevents their breakdown. This allows for the reduction of symptoms of hyperactivity, inattention, and impulsivity. Fact 4. Adderall is the most commonly abused prescription stimulant amongst college students. Fact 5. Adderall is commonly used as a study aid. Fact 6. Adderall is the most widely prescribed stimulant. Fact 7. There are several short-term effects associated with Adderall use. Some of these effects include gastrointestinal problems, blurry vision, increased body temperature, increased blood pressure, increased heart rate, reduced circulation, irritability, and insomnia. Fact 8. There are some long-term effects associated with Adderall use. Some of these effects include significant weight loss, slowed weight gain, cardiovascular impairments, hallucinations, psychotic episodes, mood changes, anxiety, sleep difficulties, heart attacks, or even death. Fact 9. Adderall is an addictive drug that can cause serious negative effects. Stimulants are addictive substances because they activate your reward pathway, leading to positive emotions. With regular abuse of Adderall, drug tolerance is likely to occur, meaning your body no longer reacts to this drug. During this time, your body may experience withdrawal symptoms, including violent mood swings, extreme fatigue, and uncontrollable cravings. To avoid this, higher doses of Adderall are typically taken to sustain rewarding effects, and this can lead to adverse reactions such as hallucinations, depression, anxiety, and obsessive behavior. Eventually, an overdose may occur because of this, which may result in a decline in brain function, brain bleeding, circulatory system failure, kidney failure, muscle breakdown, comas, or even death. Finally, fact 10. There are some alternatives for recreational use of Adderall. Some alternatives that research suggests are caffeine, a good night's sleep, daily exercise, and a well-balanced diet to help improve cognitive performances.
Adderall, which is used to treat ADHD, is also in short supply, leaving people scrambling and struggling. CBS's Meg Oliver takes a look at what families can do.
What does the sheep say?
Say bye.
Emmy Weed is juggling caring for her two youngest sons while she works from home in Huntsville, Alabama. She's also struggling to find Adderall.
And my brain feels like a jumbled mess of an inability to prioritize what I need to do. It's like a to-do list with no number on it.
She, her husband, and their teenage son, Leo, all take Adderall to treat their ADHD.
How is he struggling?
He's struggling with the impulse control, the doing flips on the bus, the getting in trouble. He's struggling with wanting to do things like you would see in regular depression, go out with his friends, be interested, clean his room, interact with his siblings.
The FDA announced a shortage of the active ingredients in the drug Adderall in its generic form last October. The agency told CBS News it is working closely with manufacturers and others in the supply chain to mitigate and prevent or reduce the impact.
Any idea why this is happening?
There's increased demand for these stimulant medications. That happened during the COVID pandemic. And it also became easier to get prescription medications because of the introduction of telemedicine and telepsychiatry.
Prescriptions for Adderall have risen almost 35% in the last 4 years. More than 40 million people received monthly prescriptions in 2022.
I have so many questions about
Families like the Wheats are rationing their supply.
I think everyone wants to take their medication how it's directed, but we're being put into a position where it's very difficult to do that. So what do we do?
With the drug shortage expected to last until at least April, experts advise patients consult with their provider on alternative treatments.